I know.
We're one of the best doctors in Indiana. And remember what he said over the phone? He was going to talk to us about this new treatment that has seen a lot of success recently. So I'm pretty optimistic that it's going to give us a much better chance to fight this thing. So
Yeah, me too.
So what's going on with our next patient?
She's been diagnosed with stage 3 melanoma, and she has already underwent surgery. So today, I think I'm just gonna plan on discussing further treatment options and what would be best for her.
So what kind of treatment do you think is going to be best?
Since surgery has shrunken the cancer site greatly, I think immunotherapy might be a really good follow-up.
Okay. Hey Morgan, hey Sam.
Hi.
How are things going?
They're going good. About as good as they can go.
Feeling good after surgery?
Yeah, a little bit better than I was before.
Well, we got your lab work back, and everything is looking how it should, so that's good news.
That's good news.
So if you guys don't have any questions or anything, I can ring the doctor and then we can start discussing everything.
yeah, that sounds good.
Okay. So Morgan seems to be feeling better after her surgery, and her labs are all looking really well.
That's good to hear considering how recent her surgery has been.
Yeah.
I think going forward, she'll be ecstatic finding out that she may avoid chemotherapy and radiation.
Yeah, definitely.
Hey guys, good to see you guys again. How are you guys doing?
Yeah, we're doing good. Good to see you.
Nice.
Well, I have some good news. We had discussed before that
You might be doing radiation and maybe chemotherapy as secondary treatment after you undergone surgery. But due to the spreading, it's not as bad as I thought it would be. And I've been doing some research, and maybe immunotherapy would be a better option regarding side effects and the outcome.
Well, what's immunotherapy? I've never heard of that before.
Immunotherapy is a treatment plan where we stimulate your body's immune system to attack the cancer cells. This can be done in a few different ways, but the most common way is checkpoint inhibitors. Sometimes cancer cells are able to hide from the immune system or turn off the proteins that signal your immune system to attack cancer cells. These checkpoint inhibitors are drugs that can help restore or turn on your immune response. The second is cell therapy, in which we remove immune cells from your body and genetically alter them, multiply them in a lab, and then re-drip them back into your body. And the third one is by specific antibodies. These are drugs that attach antibodies to a cancer cell and a T cell, and that way it brings both of those closer together and lets the T cell attack the cancer cell more efficiently.
Okay, so which one's going to be the best for me?
I gotta say, I think you'll benefit most from checkpoint inhibitors, specifically a drug called Keytruda. This drug targets PD-1, which is a protein on the T cells that help prevent those cells from attacking other cells in the body. Sometimes the immune system starts attacking other parts of the body, which can cause serious problems. By blocking PD-1, the drug boosts the immune system's response against the cancer cells.
Okay, so is it like a pill or a drug or what?
It's actually an IV fusion that we put in every 2 to 3 weeks or so. It does come with some side effects like fatigue, cough, nausea, itching, possibly a skin rash, decreased appetite, constipation, joint pain, and diarrhea. But that's just basically flu symptoms for you.
I mean, that still sounds like a lot of side effects. Do you think that's really the best route to go in this case?
Well, if you really think about it, chemotherapy is a drug injected through the IV as well, but it travels through the bloodstream to the entire body, which basically destroys and significantly weakens the whole entire immune system. Because of this, patients are often restricted to bed rest and have many more symptoms. For example, if you were to get a slight cold, you could be in the hospital for days because your body would be unable to fight off this illness. You could also experience hair loss, mouth sores, easy bruising or bleeding on top of the side effects associated with immunotherapy. Radiation is the use of high-energy X-rays. While radiation therapy kills the cancer cells, it also kills healthy cells and tissues as well.
That sounds like a very new treatment option. Are there a lot of other patients getting it done? Are there like a lot of doctors doing this now?
We actually have an interview with our oncology clinical nurse specialist with a lot of information and a lot of experience in immunotherapy. Would you guys like to watch it?
Yeah,
Yeah.
sounds good.
At the basic level for immunotherapy with our cancer patients, we tell them that what happens is your immune system is not working well to identify the cancer cells. And so with the immunotherapy, what it does is it helps to boost your immune system so that it recognizes the cancer cells as cancer cells, and actually helps to kill them off. Because normally cancer cells can disguise themselves, and then your normal T cells within your body can't recognize that. There are some patients who are more educated that want deeper information, and so when we get those types of patients, then we go deeper into the explanation and maybe videos or blogs or something like that they need more information. But the basics is that we explain to them that we're boosting their immune system to help kill the cancer cells. The immunotherapy, for the most part, doesn't have as severe of side effects. It's more tolerable to the patients. It's a different set of side effects, and usually it doesn't take as long to get it. So it may be a quick injection, it may be some pills that they take at home, but they don't usually have to come in for a full day or a full week of infusions. So time is an advantage, side effects are an advantage. You still feel bad with the side effects, but it's not as life-threatening usually, and if they do get like what we call a grade 3 or 4 side effect, which is the really bad ones, then we can usually reverse those pretty quickly with just some steroids or antihistamines. The most common ones that we see with immunotherapy, because we're getting the immune system to work, is the same kind of symptoms you would see if you got an infection or the flu. So you see like fever and chills and muscle aches, some pain at the injection site sometimes, or if they are getting an IM or a sub-Q injection, they may get a little rash at the site. But those are the most common ones that we see. And then in terms of chemo or radiation, those affect your bone marrow. They affect your fastest growing cells in your body a lot quicker. So your bone marrow, which makes the patient myelosuppressed, meaning their white counts are low, they get anemic, they get thrombocytopenic. It also affects the GI system in a different way, where since the GI system has fast growing cells, you get nauseated, you get diarrhea, you get the emesis and stuff like that you don't normally see as much with the immunotherapy. Radiation as well, when you're radiating a certain part of the body, whichever part that you're radiating is what's going to be affected. So if you're irradiating the belly area, you're going to have a lot of stomach problems. If you're irradiating the chest area, you may have a lot of cardiac issues or lung issues. If you're irradiating an area that has a big bone like the sternum or the iliac crest, then you may have a lot more issues with bone marrow suppression. With the chemo and with radiation as well, depending on where you irradiate, you also have the hair loss, which is a big thing for a lot of patients. With immunotherapies, you don't have the hair loss at all. So that's a great advantage that patients love with that too. It depends on the cancer. Some immunotherapies like Rituxan, when it was first introduced into or approved into use, we were using it as second and third and fourth line treatment for non-Hodgkin's lymphoma. But once they did more trials post approval, they realized that putting it together with the chemo actually gave us better results. Herceptin is another one, which is trastuzumab, and it works on the HER2 positive breast cancer patients. And again, at first we weren't giving it with the chemo, but now we do. Once it got original approval, it was by itself, and then eventually we do more trials, and then we see the effects of it together. Some of your other ones, like those are the two that are mainly with other chemo agents. They are doing a lot of clinical trials right now, especially like at Dana-Farber, where they're looking at your traditional chemo with like an ER/PR positive breast cancer but doesn't have the HER2 new, and they're trying to see if the immunotherapies will help to boost the effects of the chemo. So right now they're doing a lot more research trying to see if the two together will help a lot better than the two individually, because for the most part we will do one and then the immunotherapies may be more of a control where it is second or third or fourth line treatment, but we still do our standard therapy of the chemo. There are a couple of cancers, specifically melanoma, that traditional chemo doesn't work on. So melanoma patients, usually we go straight for the immunotherapies. They respond better to that, and some of the renal cells as well. It's more of the targeted therapies. They're not sure exactly why certain cancers like that respond better to the immunotherapies, but that's what they found. So some of them will get just the immunotherapies and not the chemo agents. They are actually at I think towards the beginning of really understanding of how good the immunotherapies are. When we had metastatic melanoma 10, 15 years ago, you would get like the interleukin interferon types of treatment, which is a biotherapy, but those patients were only living like 7 months average. Now they're living years and years after that with all of the different targeted therapies and immunotherapies that we have now, because what they're doing is the interleukins and interferons weren't specific to certain antigens on the outside of the cancer cells. Now we're getting to the point with immunotherapies and targeted therapies that we can figure out what kind of antigens are on the outside of the cells and what kind of interactions are going on, that we can block certain areas on the outside of the cell or the inside of the cell to keep the cells from replicating. So going forward, we're going to see more and more good responses, and patients are going to be living longer. They may still have the tumors, but it's going to be more of a control.